my pants.
Good afternoon, my name is Raelina Tucker and I'm going to talk about how to give injections. Injections can save lives. They help to prevent disease. They help to treat disease. But if they're not given correctly, they can cause problems like infection, tissue damage, pain, be ineffective, or cause damage to nerves. Self-administration at home is becoming commonplace, especially for insulin and things like that. So it's good for even non-nurses to know how to give an injection. If you've ever had a bad experience with an injection, you probably don't forget very quickly. When I was young, I got hepatitis B vaccine from a clinic that I worked at just as a secretary. They gave it in my hip. Turns out, per the CDC's pink book on immunizations, it should only be given for an adult in the deltoid or the thigh. Because of that, I had to have all 3 doses repeated. This is the normal skin, fat, muscle, the 3 areas that I will talk about doing injections. The type of syringe, needle, and technique are dependent upon the medication to be given and the client's age and size. This kind of shows you how each of the injections are given. We'll talk about each one. Different needle sizes. There's different lengths, different gauges. The larger the gauge, the smaller the needle. Intradermal injections. It's given just below the skin. You want to use a very small needle, 27 to 30 gauge, 1/4 inch to 1/2 inch, and inject at 5 to 15 degrees. It's often used for tuberculin skin tests, allergy tests. We even gave some flu shots recently this way. Sites for intradermal injections are listed here. The second type of injection that I will talk about is subcutaneous or sub-Q. It's given into the fat area. So you'll want to pinch up the skin, give it at a 90-degree angle. It's also given with a 27 to 30 gauge, 3/8 to 5/8 inch needle. So people at home often give this to themselves. Insulin, heparin, things like that. These are sites that you can use for subcutaneous injections. Intramuscular injections go all the way into the muscle. You want to give with a larger needle, usually a 20 to 25 gauge, and it'll be 1 inch to 1.5 inches, sometimes longer than that, depending on the size of your patient. These are some sites for intramuscular injections: the deltoid, the thigh, and then 2 sites on the hip. On the deltoid, you want to find the acromion process, and that's this bone right here. You go 2 finger widths down, do an upside down triangle, and you're going to give in that area there. The vastus lateralis, you use the thigh, divide it into thirds, and then give it into that middle section on the lateral side of the thigh. 90-degree angle, usually 1.5 inch needle. Now, one of the sites for the hip is the dorsogluteal site, and you see it here. You want to give it in the upper outer quadrant. There are some blood vessels and some nerves that run through this area. That's why it's at risk for nerve and blood vessel damage, so they really don't recommend the dorsogluteal very often anymore anyway. They really recommend using the ventrogluteal site. Now, it's a little more cumbersome, I feel, but it's a lot safer. There's no blood vessels and no other, you just go into muscle. So what I have people do is you have to find this greater trochanter. So I have people kind of stick their hip out at me, put the ball of the hand on that greater trochanter, and then you find those landmarks there, and then you're going to give it right between those 2 fingers. This is some positioning techniques to use when you are giving injections in the hip. Again, to do the ventrogluteal if they're laying down. Now for children, it's a little bit different. You cannot use the hip muscles till they're a little older because their hip muscles haven't developed yet. But it's basically the same. The thigh, the deltoid after they're about 1.5 years to 2 years of age. Now that you know kind of about each type of injection, the steps to giving an injection, number one is to determine if it's appropriate for your client. Is the client allergic to the medication? Do you have a current order for the medication? And is it the appropriate dose for that client? If it is, you can get started by washing your hands. 20 seconds, then gather your supplies. You'll want an alcohol pad, Band-Aid, gloves if you feel like you might have some blood. It's always a good idea, not mandatory. And then to draw it from the vial, you want to use obviously sterile equipment, and then you're going to inject a little bit of air into the vial before you try to draw the medication into the syringe. So you turn it upside down, make sure the needle is below the level of the medication, and you draw however much you need to give to your client. Sometimes you'll get some air bubbles. You can tap on the syringe to get those air bubbles to the top, and then push that out. Then you're going to give it however, depending on what medication it is. So in this case, I just put vastus lateralis. You want to prep the skin with alcohol and then let that dry. Give it plenty of time to dry. Now, if you're giving something at home, insulin, they don't even recommend using alcohol. Just make sure the skin is clean. Now, with IM injections, sometimes it can leak back out and cause some pain if it gets into that adipose tissue. So the Z-Track method is always good to use. And this shows you how to do it here. You're going to use your other hand, push that skin over while you give the injection, and then after you're done, release that. That keeps the medication down here in this area instead of leaking back out. They do say to give 1 cc over 5 seconds, and then to wait 10 seconds before you actually withdraw the needle. Now the ACIP's general recommendations on immunizations about aspiration. This says aspiration is not required before administering a vaccine. There's no reports of any injuries if you don't aspirate. However, in multiple nursing periodicals, I did read that they still recommend that you aspirate if you're using the dorsogluteal site because of the risk of those blood vessels. Another interesting note, in 2007, they did a study in Canada. They had infants that they gave injection to rapidly. They didn't aspirate and they withdrew rapidly. Another group, they gave slowly, they aspirated, and they withdrew slowly. And the pain scales, the infants were obviously in more pain when it was given slowly. So with children, we do recommend that you give it a more fast approach. Now, hypodermic injections have been very useful in helping to prevent and treat disease. If given correctly, they can save lives. If given incorrectly, they can cause excessive pain and complications. So we should all make the decision to be informed and to give the best injection our clients deserve. Any questions?